Hello radiographers, hope you are doing good. Let's start tryphase CT scan of liver. At first, register the patient, enter the patient name, ID, and then sex of the patient, and then age. Weight is optional for CT scan, but compulsory for MRI. Height and weight. Then click exam and select the from the abdomen area. From the abdomen, select abdomen multiphase or abdomen contrast as saved as in your software. Here I did a mistake, you will see now. In case of patient positioning, selecting patient positioning, you will see now the mistake. So for topogram, press start button from the control box and the scan will start for topogram. You can see that my topogram is actually upside down because the table moved outside from the center. That's why this gives a upside down topogram of the skull. So I did a mistake. The mistake is that I select the patient positioning feet first, but I position the patient as head first supine, but select as feet first, or it was automatically selected, but I didn't change it. So right now I am correcting it again, positioning the patient to the center at the mid chest. Yes, the patient is positioned again, and then I will repeat the topogram again, and now I will select the from the patient positioning head first supine, and it will be correct, and then press OK. So I am taking the topogram again because I did a mistake. I didn't select the patient positioning, so I got a upside down image or upside down topogram. So this is the second topogram I took, and now it's a correct one. It gives a topogram of the abdomen. So now adjust the field of view of the scan and drag the top border of the slice to the above the diaphragm, and lower border of the scan field of view at the L3 level, then it will be okay for liver. And then press move button and then press start for non-contrast scan. So this is the first scan of the liver, and it's a non-contrast scan that has been completed now. And it's reconstructing. The CT scan triphase means the three phase, and the three phase is arterial phase that is taken just after 20 to 30 second post contrast, and then portal venous phase that is 60 to 70 second after post contrast, and then delete phase that is taken 3 to 5 minutes after post contrast. So for a triphasic CT scan of liver, the amount of contrast administered intravenously is typically 1.5 to 2 milliliter per kg of body weight, with a maximum dose of around 100 to 120 millimeter. The contrast is usually followed by a saline flush to ensure adequate delivery and enhancement. And the injection rate is typically 4 to 5 milliliter per second, and a saline flush is about 20 to 50 ml. And obviously use auto injector for pushing the contrast and bolus taking. In this case I did it manually because I had some limitations for auto injector. I did it manually and scan and adjust the timing by manual. Right now I am taking the arterial phase and adjusting the field of view for arterial phase. In the meantime, I prepared my contrast, and now press move button as you prepare the contrast and cannula for patient. And in case of auto injector, press the start button of the scanner and the auto injector at the same time and use bolus taking method, but in this time I did it manually. So arterial phase is scanning. You can see the contrast is on the abdominal aorta in the arterial system, and now the portal venous phase will be scanned just after 40 to 50 seconds. This is the portal venous scan, and I took additionally venous phase scan just after the portal vein scan. This is optional and it's not a part of TIE phase. So 3 scan complete simultaneously: arterial phase, portal phase and venous phase. And now I have to wait for 3 to 5 minutes for delayed phase. In the meantime, the images will be reconstructed automatically, and I will make some manually. I am making third reconstruction for arterial phase and dragging the upper slice to the upper dome of liver and lower slice or last slice at the level of the kidney. And now I will press recon. And the recon will start for arterial phase. And I will make portal phase axial images or reconstructed images again like arterial phase, and I will select 28 images to be reconstructed. So this is the third reconstruction for portal phase, and again I will make another reconstruction for venous phase. This is the third reconstruction. I select 3 and drag the upper and lower slice like the arterial and portal phase, and then click recon, and the recon will start for venous phase. So this is the phases. So 5 minutes up, I will now take the delete phase. Click the load button and press the move button from the control box. So table will position as centered, and now click the start button. So 5-minute delayed scan has completed now, and check out the image. You can see that the contrast is coming through the kidneys, renal pelvis and the ureter. And delayed second reconstruction is now going on. It's 1 millimeter thickness reconstructed, but I will make third reconstruction for delayed phase like arterial, portal and venous. So I am making axial images, 28 axial images for the liver delayed phase. Now go to Passion browser. And select all the faces that you created manually, like arterial face, portal face, venous face, and delete face, to see together all of them together. You can see that the first segment is the non-contrast phase, and then the arterial phase, and the third one is the portal venous phase, and the fourth one is the venous phase. The venous phase is not a part of the triphase, but I took it additionally. The triphase include arterial phase, portal venous phase, and delayed phase. So this one is a delayed phase that now I am scrolling. So I have to select non-contrast and take it to the filming, and now I am in the filming. I have to drag the topogram to the film on the first segment. This is the topogram that I took, and adjusting it. For non-contrast axial images, I have select the 5:6 layout so that 30 images fit in the film, and adjust the non-contrast axial images. So this is the first film for my triphase CT scan liver. Now I am selecting the arterial phase and send it to the filming. And for arterial phase, I will select 4:7, and it will allow us to fit 28 slices in the film. So this is the arterial phase film I made, and now I will select the portal venous phase and send it to the film, and adjust and zoom the images to fit in the segments. So this is the portal venous phase film that I am making. I am also taking the venous phase and making the film for venous phase, but venous phase is not compulsory, it's optional. You will avoid this, you can avoid this, but delayed phase is compulsory, and delayed phase is among the triphase. And now I have to create coronal images from the arterial phase. So that for this I have to drag the arterial phase 1 mm slice thickness reconstructed images to the 3D tab, and from the 3D tab I will plan on the axial images to make the coronal image, and changing the image thickness to 5, and number of images I am choosing is 12. Log the slice number so that the number does not increase in case you drag the slice. So I have changed the number image to 15 and save the coronal images for arterial phase and send it to the filming. And now I will make coronal images for portal venous phase. So I will drag the portal venous phase 1 mm slice thickness to the 3D, and again I will make coronal images for portal venous phase, planning over the axial image and changing the slice thickness to 5 and selecting number of images to 15. And click start, and the portal venous coronal images will create and save and send it to the filming. So now I am filming, there is 30 images, 15 arterial phase coronal and 15 portal venous phase coronal, and now I will adjust these 30 images. So this is the last film that I preparing. So I have prepared non-contrast axial film, arterial phase axial film, portal venous phase axial film, and then venous phase axial film, that is optional, and then delayed phase, and then arterial and portal coronal phase. So these films I have made for printing. So thanks for watching. If you like this video, please hit the like button and subscribe my channel. So if you have any suggestion or any question, you can comment me, and I will try to post videos like this regularly. And your reaction, your like, your comment inspire me to post more videos like this. I am trying my best to share my knowledge and share my experience with you all the radiographers. Hope you best. Keep learning, keep practicing, and it will take you to the upper level. There is no limit of learning, no age limit of learning. You can learn in any age. And don't be shy to ask question, don't be shy to gain knowledge. So thank you again. Keep safe. Goodbye.